For literally months, the CDC has recommended all pregnant women get vaccinated against COVID-19, yet this still isn't happening. In fact, tonight there are 7 pregnant people hospitalized with COVID. 2 are in ICU. Our Nixon Norman has more on why it's so critical to be vaccinated.
We had the highest number of admissions of any month in the entire pandemic in the first 18 days of August.
And many of those getting seriously sick were also pregnant.
The amount of patients that were critically ill seemed to be significantly higher than we had seen before. Whereas early in the pandemic, we may have 1 or 2 critically ill pregnant patients a week. We actually saw these numbers significantly rise in July and in August.
For many, being critically ill and pregnant resulted in a highly stressful situation.
Between 20 and 40% of our admitted pregnant patients were actually admitted to an ICU setting.
But pregnant people being more vulnerable to viruses is nothing new.
If you think about the H1N1 pandemic, so the flu pandemic years ago, it really did disproportionately affect pregnant women because there are certain physiologic changes associated with pregnancy that sort of impede or make, respiration more difficult, especially as the pregnancy proceeds.
Experts recommend not only pregnant people, but everyone who can, to get vaccinated before we see another major surge like we did when the Delta variant first started floating around.
So really, during this lull, before we have another wave, before we start to look at people going indoors for fall and winter, when we usually see the respiratory viruses peak, let's take the opportunity to get vaccinated if you're not already, and to think about booster doses. If you're eligible for a booster dose, talk to your providers if you have questions about that. But we can't let our guard down. The viruses are smart and they will keep changing and mutating, and we have to have a smart response.
Nixon Norman, Fox 54 News.